Hello and welcome to Tardigrade Talks. I'm your host, Dr. Joti Samra, and this is a podcast for anyone interested in cultivating greater psychological health, wellness, and resilience. In this week's episode, I am very excited to introduce you to our guest, Susi Bolender. Susi is a registered clinical counselor with her master's in counseling psychology. She has formerly worked as a school counselor and a mental health therapist with children and teens, and has been a passionate advocate for the deaf community for the past 20 years. Susi is also a clinician and coach on our Dr. Joti Samra and Associates clinical team, and she's experienced in a range of evidence-based modalities, including DBT, CBT, self-compassion approaches, and is a certified facilitator for Brené Brown's Daring Way approach. We'll be talking about the importance of understanding courage, shame, and vulnerability to enhance resilience, the powerful role of humor and perspective in therapy, and how the personal life stuff that clinicians go through can keep us humble. A great, big, huge welcome, Susi.
Happy to be here. Looking forward to chatting.
Well, so much for us to talk about today. And what I'd love to start with is learning a bit more about your career trajectory and the background that brought you here to counseling, because you, of course, have a range of experiences. Have worked as a school counselor, as a mental health therapist. You've done a tremendous amount of work with the deaf community. And so please share a bit of your path toward becoming a counselor.
I think from an early age, I always knew that I would find myself in a role where I was getting the most satisfaction out of helping other people feel better. I remember one of my earliest experiences was a good friend of mine who we grew up on the same street, and we were teenagers, and she had a close friend of hers pass away, and she was really upset about it. And I just felt a desire to support her in those moments. And I think that's kind of where it started, is I felt like I just wanted to help her figure out how to get through it. And I didn't really ever see myself as a therapist then, but I had that urge to kind of support other people. And when I was, not that much older, maybe like 16 or so, I got this inclination to take a sign language class, which put me on a trajectory towards working with people who had issues with hearing. And I grew up actually in Ontario. And over the course of several years and taking different classes, I wanted to continue to progress that area of knowledge and had to move out to British Columbia because the schools in Ontario, they didn't actually have the higher levels of education I was going after. So I moved out here and kind of took this very windy path, doing one thing after the other. I worked in some group homes with people who had special needs and supported people who were deaf, blind. There's intervening services, and just kind of found my way gradually as I ended up becoming a sign language interpreter for a large portion of my career. And through that is when I really kind of culminated all of these experiences into wanting to be a therapist. Because as an interpreter, I started working in a mental health office, which is the only program in the entire province that supports exclusively the needs of deaf and hard of hearing people. And I started working there as a sign language interpreter with some of their clinicians. They had a psychiatrist on staff and psychologist that was consulting. And I was so inspired by the work that they were doing, but also felt as if the deaf people now, instead of speaking directly to the therapist, had to also go through a sign language interpreter. So I really maybe that seed that was planted in those early years was somehow just fertilized in that environment. And I thought, you know what, I need to do this so that I can provide direct service. So I rolled up my sleeves, went back to school and got my master's degree in counseling psychology, and then started working for them instead of as an interpreter, started working as a therapist. And then from there, moved to Burnaby South, where I work. They have a school for the deaf that is housed in Burnaby South. And I worked with the youth there. I also worked as a childcare counselor. And just over the last maybe year and a half, I got a real pulled to do something different, more broad, and connected with you. And I'm very fortunate to be working with some of the clients that have come to me through your practice. And I guess that's the big, long story of how I found myself doing what I'm doing these days.
Yeah, well, wonderful to hear of that kind of trajectory, and this thread, right, that I'm hearing as you're speaking, Susie, that is the passion to want to help and support. And so that was always that core thread for you. It sounds like it had a few different manifestations over the years, kind of maybe as we look at the CV on paper, but really a natural extension and evolution for you as well.
Yeah, definitely. I know some people talk about it being a calling, and I definitely feel like that was my experience, that it was something that, as far as I maybe deviated away, I always came back to it and challenged myself in several different areas. And really, this is the most fulfilled that I've felt. I'm really pleased that I'm able to provide, even some of the experiences that I've been through some of my own personal hardships along my own journey, and persevered and learned skills and tools that have helped me. And when I sit with clients and work with them and have something that has been effective for me that I can share, and then I see them say, yeah, I think that might work for me too, or I'll try it and see the positive change. It's just so rewarding to see that growth in others also.
Absolutely. And those life experiences, right, that keep all of us humble, and especially those of us that are in the therapeutic world, a little extra humble, because life happens to us, right? Just the same way that it happens to those that we serve in the therapy room. When you go back and remember when you first developed that passion to work with the deaf community, where did that come from? What kind of ignited and instilled that passion for you?
That's kind of a funny story. It was very random. I wish that there was more kind of purpose or some altruistic goal, but it was really just somebody had mentioned something to me kind of off the cuff about how they could see me working with deaf people or senior citizens. And at that time, I think it was 15 years old maybe. And I just thought, what a ridiculous idea. Like, why would I ever do that? But for whatever reason, that comment sparked a little bit of interest. And I thought, sign language seems cool. I would like to learn that. And they had, there was no Google in those days. So I had to figure out where can I learn sign language? So they have an organization in Ontario called the Canadian Hearing Society. And I took a class, and what's kind of funny to reflect on now is shortly after I became more involved, I did some volunteer work, and I found it all very interesting. It was almost like learning charades, because when you take a sign language class, most times, as it should be, it's a deaf instructor because it's their natural language. So they're sharing it with non-deaf people so that we can learn and share their language. So you don't understand what's happening. You go in and you can't communicate with the teacher, which is a very strange experience. So a level 1 class is kind of like charades and figuring out and trying to understand, what are you trying to say to me? Even though there's no way, I mean, I suppose you could write down on pen and paper, but it's more fun to try and figure it out on the fly. So I ended up, after a couple of lessons of doing that, they asked me to teach a lip reading class, which today I have the cultural awareness that is a big no-no to teach a hearing person to go in and teach lip reading. It was, but back then, I mean, this is quite a while ago. So I was like, sure, I'll do anything. It's fine. I'd love the experience. And I just really dove into that whole experiencing the culture of it, and didn't really know what I was getting into in those early days. And it led me through a very long part of my career history. And I'm so thankful to all the deaf people that share their language with us novice hearing people that don't really know what we're doing and make a lot of mistakes. And they just have so much patience to put up with a learner like me trying to fumble through their language. But it was something that just was a massive part of my life. I would say more than half my life that I've spent working with the deaf community.
Was there anyone in your immediate family or community or extended community that was deaf, Susie, or that was fluent in American Sign Language, or was this just very kind of happenstance?
It's funny that you asked that. It was totally happenstance, but afterwards, what I never connected is my sister actually is completely deaf in one ear. She had an injury when she was very, very young. So since the beginning, she's been deaf in one ear. And we always will have to go, is that your deaf ear? And then walk over to her other side. But I never really thought of it as anything other than normal. But she never knew sign language because she could speak fully and hear out of her one ear. But it was always like you would say something and she would ignore you. And I was like, excuse me, you get a little miffed with your siblings. And then she'd be like, you're on my deaf side. So I did have exposure, but I never really made the connection that I did have the exposure. And then all these years later, it's become, such a big part of what I do and who I am. So most of my family there is nobody that uses sign language in my family. I did also reflect later on that there was a boy in my elementary school who at that time, they didn't integrate classrooms. So he was, pulled out into who knows where they took him to work one-on-one with a teacher. But not really, I never really connected with him. I have no idea what he's up to today, but I did have some exposure that I never really realized was maybe impacting me more than I thought.
Yeah, it's interesting, isn't it? Because one is, there seems to be, I think anytime and I think this is true in life, like anytime we're kind of gravitating towards something that's unfamiliar or different or that we don't know about, our mind wants to put together the story, doesn't it? Of like, oh, why? What led to this? Or what was your chronology? Yeah. And as you're speaking, I'm thinking, well, sometimes it actually isn't there at all, or we're not aware of it, right? It may be very, very subconscious, but there is, now, not to sound like a touchy-feely psychologist, however, there's that intuitive feel, right? It's like, so here you are, a couple of maybe experiences that you say, okay, those weren't marked things that made me passionate about going to work with the deaf community, but someone plants a seed, something gels, something intuitively in you is like, yeah, this sounds cool. Let's go pursue this. And then there you are 20 some years later, immersed in a field and a profession. Up on a few things that you've touched on, Susie, and one is the spectrum of hearing impairment, because as you're speaking and you're describing your sister, right, my mind at least certainly wouldn't go to thinking deaf in the sense of what we think of when we're thinking of someone who fully identifies with the deaf community. We're thinking of someone who has some hearing impairment or loss. But yeah, tell me there, because you're going to be able to speak to this much more intelligently than I can even ask the question here. But there's a spectrum of loss, and there's this, to talk about that. Talk about the spectrum, talk about the identity component, because one of the things, and I thank you for educating me on this when we were actually putting it was your bio or a social media post or something that we were doing, you came back with an edit that our team was doing and just gently advised us to make sure that we capitalize the word deaf. And I had actually never been thoughtful of that and didn't actually even know that. And so talk a bit about language, identity, community, and the spectrum.
I am so grateful for this question, because as a majority hearing cultured person who has spent so much time being invited to the deaf community with open arms and, worked alongside a lot of people to kind of push the agenda of accessibility and acknowledgement and recognition, I think that the majority of hearing abled people have no idea about exactly what we're talking about right now. And they don't understand that deaf people, the only thing that is different is their ability to hear. They're not intellectually different. It's and there are, as you were saying, this spectrum of appropriate terminology, how you speak to people. Many times in my interactions with people, they will shy away from using the word deaf because they think that saying deaf is insulting. Deaf, and to use the word, I'm deaf, I am part of the deaf community, is actually empowering, because it encompasses their identity as an individual. Not to get too deep into it, but just a little bit of history. In 1880, there was something called the Congress of Milan, which was part of this educational forum that came together that decided how education was going to happen. And it was related to the deaf community. And in 1880, there was a motion put forward that they would no longer educate deaf students with sign language. Prior to that, deaf people were completely on par, doing the same kind of work, having the same kind of access, the same kind of jobs. There was no difference other than you can't hear, I can hear, I can run 50 meters really fast and you can't. Like, it was no different. And then that changed everything. And, this oral method was introduced, trying to force deaf people to talk, hearing aid, like all of, I would get into the political piece of it, but I'm not that well versed in it. I just know that at that part in time, everything shifted and deaf people became seen as different, disabled, which they are not. And this idea now where we stand, and things are changing rapidly. And in the last 5 to 10 years, there's been a real embracing of the culture in the mainstream, right? There's, you think about baby sign language and things like that. The irony is when a deaf baby is born, oftentimes a doctor will advise not to teach them sign language so that they can develop abilities to hear and speak, which 9 times out of 10 doesn't happen. And then they will advise parents that have hearing babies to expose them to sign language to develop their language quicker. So what you end up having is deaf children who were delayed in their language acquisition, and then hearing children who are far more advanced. So it's really a very bizarre situation that we found ourselves in. Thankful now that there's a lot more awareness and deaf advocacy and deaf individuals who are leaders in the community who are trying to get the message across. And just to go back to the capital D, small d, deaf, hard of hearing, hearing impaired. Hearing impaired we'll just take that one off the table. For anybody that's listening to that podcast, we'll steer clear of that term going forward because it's a very medicalized, autist viewpoint of hearing loss. So to say deaf is usually just kind of denotes any type of hearing loss. A capital D deaf is a cultural connection to being a deaf person. There is language, there are traditions, there's culture, it's a cultural identity with a capital D. And then a small d is just like my sister. She would be small d deaf is what they call it, where she has some level of hearing loss, but she doesn't really connect on a deeper level to the overall richness and culture of the deaf community. And then there is different, somebody who might be a senior citizen who has lost their hearing over years would be late deafened. So there's all these different terms. But I think that if we're speaking about what I've learned through my experience is that deafness is definitely not an impairment. Some people are even, I'm thinking of some people that I've met along my own personal journey, and they're just so rich and full of life and brilliant and contribute so much to so many different causes. And I would never, ever, ever see them as being impaired. So I think it's really amazing how much more sign language we're seeing, especially during the last year and a half of COVID. Everybody knows Nigel, who has been in the box, signing the messages from Dr. Bonnie Henry daily. And I think there's just that has really kickstarted the level of awareness about what's going on kind of in this community of people that has been kind of looked over and considered as being a disabled population when they just really have so much to offer. The only thing they can't do is hear.
It's interesting because as I was prepping for our conversation, I reflected on the fact that I, of course, like many of us, have known many people that have had hearing loss over time. I'd say 95% of the time it's been in the context of someone who's elderly and has been gradually losing hearing. And I thought, I actually don't know anybody in my immediate or even extended community that has someone in their family or close to them that is deaf. And I looked at the prevalence data, and I was surprised to learn that in Canada, this is 2018 data, 340,000 Canadians would identify as deaf, and there's over 3 million that would be hard of hearing and have, I guess, that hearing loss or impairment category that you're speaking about. And the numbers were so much larger than I think I would have guessed, probably just biased by my own limited experience.
while we're on this subject, I think it's interesting. What was I doing the other day? I think I was riding my bike, and I was just out in Vancouver riding around. They have such great bike trails in Vancouver.
Mm-hmm.
And I had ridden past someone and they yelled something at me. I don't know. Maybe I was too close to them by accident. I hope that wasn't the case. I hope they were yelling at somebody else and had nothing to do with me. That's what I heard. And I thought, if they were trying to get my attention, like maybe something fell off my bike and they were yelling at me. If I was deaf, I would have no clue and they would think I was rude. You know, it's just because you can't see deafness as something that is limiting communication. People are not aware of it the way that you were just speaking of. It's like you could have walked past 3 or 4 deaf people in a week and have no idea because you would not be able to see it. So it is interesting how many more people do have hearing loss that are out there that we're just not even aware of.
When we think about communication, right? And you've probably heard me say this many times, like we're fundamentally social creatures, and our social relationships and how we relate and interact and by extension communicate, right? Is the heart of what we do as human beings, is we relate and we connect and we communicate. And then we think of something that impacts and creates a differential in how we approach that communication has so many layers of impact. And one of the things that stunned me yet didn't surprise me was that if we look at members of the deaf community, they're twice as likely to experience mental health concerns. And it's immensely more difficult, to a point that you alluded to earlier, to even connect with any kind of supports when they want to reach out. And so talk a bit about, Susi, just your experience, both as a translator and as a therapist, in understanding the impacts on communication and by extension mental health, and some of the really tremendous barriers that exist when it comes to access to services.
That is a subject that is near and dear to my heart. I have to say, I've, when I was in grad school, my bachelor's thesis was on the lack of accessible services and mental health care for the deaf community. And I've since written articles and spoken at conferences because that's a piece that gets me every time. I think it's so unjust that we have services in Canada and British Columbia that are not accessible to people just based on the fact that they cannot hear. It's devastating. And if you actually look at the research, which I don't have my own research in front of me, but when it talks about employability skills and underemployment for the deaf community, they are just so much further behind because as a hearing majority culture, we don't make ourselves accessible. We put up the barriers. They're not barriered. They have full language and community. If you have ever seen 2 deaf people in a conversation with each other, it is the most dynamic, animated, interesting conversation. You would just love to know what they were talking about because it's just so interesting to watch. I've had people come up to me and say, oh, it's so beautiful what you're doing. And to me, I'm like, I'm talking about physics right now. How is this beautiful if I'm interpreting in my previous life, right? Like, it's like, you don't even know what you're seeing, but because my hands are moving and my face is so expressive. And back to the Nigel, right? Like every time somebody knows or realizes what my previous career was, they're like, oh yeah, I've seen Nigel on TV. He's so expressive, which is true. And there's just so much dynamic language that's happening. And then when you think about how barriered society is, that's where the barriers are on that side. And, the government talks about built environment and like how we're going to adjust for like wheelchair ramps. And then people never think about, well, how do I accommodate someone with a hearing loss that uses sign language? Mm-hmm. They don't want to pay for accommodations. So one of the things that is a thorn in my side more than anything else is I've had lots of experiences with legal offices where a deaf person has to go to get some kind of consultation or meet with a lawyer for something. And the lawyer's office often will refuse to pay for the sign language interpreter. Huh. So yeah, it's pretty frustrating because then this deaf person is like, signing contracts that they don't fully understand or, all of these, but nobody's really taking anybody to task over it because the deaf community and these professionals are so overworked and overwhelmed trying to, get the agenda going for some of the things that are, something's going to fall off the list is I guess what I'm trying to say. And they can't fight all the fights all the time. So it makes it really difficult when you come up across all these barriers and, who's able to take care of this. In the United States, they have what's called the Americans with Disabilities Act, which is kind of a more prescriptive type of, you must provide access. And in Canada, the Section 15 speaks to if you, as a business owner, basically, are not going to have undue financial hardship by paying for an interpreting service, then you have an obligation to do so to make your services accessible. So the rule of thumb is the idea that if you are charging a fee for your service, you have the responsibility to also make it accessible. And then that's your duty to do that. But then if you think of something like, a therapy setting where a lot of clinicians may be in private practice, maybe their hourly rate is anywhere from, say 120 to 170. An interpreter has a minimum charge of 2 hours, which is $150. So that means that clinician, if they have to pay for the interpreting service, is going to make $30 on that appointment. How do they maintain? So there's all of these complicated pieces, and there's no real funding to support it. So deaf people end up not being able to access mental health services. As I mentioned, there was the one program, it's called the Deaf Wellbeing Program. It's in Burnaby. I mean, they have their own limitations and they can't do it all. As you mentioned, the numbers yourself, right? I think you said 340,000 in Canada. So proportionately in British Columbia, that's a lot of people for one small program. And then that also limits the right of choice. It's just very frustrating. So there's barriers on top of barriers on top of barriers. And the hearing population that doesn't understand will look at the deaf people and say, oh, well, this is a you problem. You're the one that can't hear. It's like, no, you're actually not accessible.
What is one step, action that you would encourage that people can take to either learn a bit more, educate a bit more, or advocate? So for every person that says, wow, I didn't know this, and where can I even start? What would you suggest, Susi?
Oh, wow. That is a heavy question, because I would love to say like everybody should learn sign language, right? That would be my dream, but that's a hard one to crack unless you've got a magic wand in your back pocket. That would be lovely.
Oh, wait, hold on. No, I forgot mine today.
Darn it.
Yeah, no, I'm hard. And sincerely, because I'm hearing and I'm thinking, wow. And my first thought is what can be done? Like, where can someone start when I don't speak American Sign Language. I don't even have someone in my circle that I could connect with to directly have some person to person impact. So it makes me think, education maybe is that.
I think what I would say is probably the easiest way to start, and this would be like to every person, right? Everybody could do this thing. And if you work in a organization, and this is like just off the top of my head, so it might be a little not pretty, but I'm trying to figure out the best way to say it. If you work in an organization in which you provide some kind of client-facing services, if your organization pays for people to come in and clean your floors, then you should advocate that your organization should also pay for a sign language interpreter at minimum to serve a deaf person who comes in your doors. Does that make sense?
Awesome. Yeah. Love it.
People have budgets for things and they will spend on cleaning fees and, somebody to come in and service their coffee machine or their photocopier. Well, maybe not today because it's COVID, but if you work in an establishment where they're paying for XY services, then there is absolutely no reason. And then if you are a frontline person, you could advocate to your boss, I think it's reasonable that we cover the expense of the sign language interpreter, and then figure out just Google BC sign language interpreters. There's a provincial association called Waverley. They are members, they're professional, they have a code of ethics. They all have graduated from a training program. So there are qualified people out there ready and willing to do the job. But if establishment is, just saying no, because it's often what they do at a first request, just because they don't know. So anybody that hears this, if they just put it in the back of their mind, then it's like, well, we pay for this. Why wouldn't we pay for that? It's a service. It's the same thing. It's totally reasonable, instead of getting freaked out and just saying no immediately.
Let's shift gears a bit, Susi. You are a certified facilitator in the daring way approach that Brene Brown, one of my favorite people, well, favorite imaginary, not imaginary, but what would it be if you don't actually know somebody? There's got to be a better word to that. But, love Brene Brown. And so many of us I think, have been really impacted in such positive ways by some of the really important messages that she puts out around shame and courage and vulnerability. And we just love to hear first what drew you to go get your certified training and talk a little bit about the Daring Way approach.
Yeah, it's funny that we're trying to switch gears, and yet it comes back to that, my experience in the deaf community. How that all came together with the Brene Brown work was I had graduated from my counseling psych program and had started working at the wellbeing program. I think I was doing a maternity leave. And one of the things that really was a big takeaway from when I did my practicum work during my master's program was one of my supervisors, when reviewing one of my sessions, because as part of our work, we have to do a placement where you're getting practical experience working with clients, and you have to videotape it and send it away and have it reviewed and get feedback. And one of the things that I was working with this individual with, and I was kind of going in circles, and the feedback was from the supervisor was, are they talking about shame? And I thought, oh gosh, that's it exactly. And it just kind of all just came together in that moment, that I never even thought of how intense the feeling of shame is, that is so deep beneath the surface for some of us that we don't even have an awareness of it. So that was the first kind of, as we were talking about earlier in this conversation, these little kind of like beacons that guide you. I think that looking back, that was definitely a moment. And I was working with deaf people, when we talked about shame, I think I probably Googled, and I was like, what is the antidote for shame? Like, I wasn't even, I just didn't even know where to start with that.
Gotta love Dr. Google.
That was the first, and one of the things that came up was the work of Kristen Neff, which is mindful self-compassion. And I was quite intrigued by her work. So I decided to sign up for an 8-week course, because I thought, well, I'll get trained in mindful self-compassion, because that seems like that's the best fit for how to deal with shame and tolerate it and integrate it and work through it, and et cetera. So I went for my 8-week course thinking like, this is going to kind of be a bit of a joke. I'm just going to sit on the sidelines with my pen and paper. And I actually really, really appreciated what I learned from it. The takeaways were immense for myself personally, because in order to take the practitioner piece of it, you have to have done the course yourself. But working through it, it was life-changing. I would highly recommend mindful self-compassion to anybody. Though what I recognized, because I was working at the Deaf Wellbeing Program during that time, was that most of it is guided meditation, which is auditory. So it wasn't going to work because I'm working with deaf people. So I thought, how am I going to do, can you do visual? Like, it's too distracting to be signing, because you're like looking at everybody's facial features, or, it just was like, this is not the thing. This is not the thing. So I dug a little bit deeper and kind of stumbled onto Brene Brown's work. At that time, she had just come out with The Gifts of Imperfection. Highly recommend. One of the best, easily digestible kind of books that she wrote. I think it was probably one of the first. And it was funny also, now that we're talking about all these beacons, is I remember at the time someone had mentioned to me this vulnerability TED Talk and sent it to me, and I thought it was stupid and I wasn't going to watch it. So, yeah, I was just like, what is this? This is ridiculous. What a waste of my time. That was maybe like a year or two prior, and they were like encouraging me to maybe like get a little bit more vulnerable. I was like, no, thank you. I just didn't even, yeah. It's funny when you look back. But so building on these pieces, and then I made that connection. Oh, that's the same thing. Oh, interesting. And then I think I watched it, and it was more palatable at that time on round 2 to watch it and actually like have it kind of sink in a little bit. And then one thing led to the other. I like read all of her books. I found what she said to be so relatable and real, and it just made sense to me. And I thought, this is the work that I can do with the deaf community. So I decided to go to Texas and take her training just to get back on track with where I was going with this ramble. And then I came back and was still contracting, doing work with the wellbeing program. And they sent me kind of all over the province to do the workshops. The way that this is delivered is she has 3-day workshops or 8-week workshops where people come twice a week or once a week, and you deliver the materials. There's a curriculum. There's 2 programs. One's called Daring Greatly, and the other one is called the Rising Strong. And they are like actual curriculum that you work through in groups. Unfortunately, during COVID, there's not been an opportunity to do any groups in a long time. So I kind of miss that. But I do, with some clients, trying to integrate some of the curriculum and information from those programs.
Read an excerpt from something that Brene Brown has written, and would appreciate your thoughts and reflections. Vulnerability is the core of shame and fear and our struggle for worthiness. But it appears that it is also the birthplace of joy, of creativity, of belonging, of love.
Yeah, that's great. I got goosebumps. So that's when you know something was real. It's like head to toe, just shivers with the realness of that message. One of the things in her teachings that kind of impacted me, which I think is embodied in that quote, is the idea is that you can't enjoy the light without the dark, and vice versa. Like they are both there. So you have to, she talks a lot about numbing. And the idea is when we let go of, who we are, or we freeze out certain aspects of what's important to us or what brings us joy, it's like you're trying to push away from the things that cause you pain, but while you shut down, you also push out the things that bring you joy. So I think that that's such an important piece of just the learning for everybody. When you dig into that, you can grow something else in that dark space that you choose instead of something that has kind of got its claws in you. You can break free from that, let it go, and then flourish in a new way of your choosing. And I think that that's something that I try to encourage all of my clients to do. It's like, what do you want to choose to do? Because you can move with intention into a better feeling place than you've been.
When you think about working on introducing the construct of vulnerability in the therapy room, and I believe ultimately, it's almost impossible for therapy to be effective unless people are willing to at least shed a little bit of the armor that we naturally build up, right? When we're exposed to all kinds of life stuff that comes our way. How do you help clients find that happy place? And I don't, there's that piece because it's scary, right? It's scary when we think of being vulnerable, especially when we have been vulnerable and have been rejected, have been pushed against, metaphorically and sometimes even physically, when we have learned that will lead to hurt and pain and not serve me well. How do you start to introduce even the importance of vulnerability?
I think one of the biggest pieces there is the misconception. And if anybody's seen a TED Talk on vulnerability, they'll know what I'm going to say is that vulnerability is a weakness. It's not. It's being brave, right? To be able to go to that place and be open with somebody else or even yourself in that moment, and just really acknowledge that there is some level of pain or hurt and not shield against it, but instead welcome it almost as an opportunity to grow and change and make choices about which direction that you want to go in. Again, it's so funny. I'm going to hook back to that sign language piece again, because in one of her interviews, Brene is being asked, she speaks about needing or interpreters at one of her, I don't know where she was talking. She was doing some talk and there was deaf people in the audience. So they had hired interpreters to come in. And as common practice, interpreters will meet with a presenter a little bit beforehand and just say, are there any specific terminology that you'll be using? Are there any points that are important for us to understand before we, continue on, because the goal of the interpreter is to have message equivalency and make sure that whatever the speaker's goal is, it's coming out in the second language. So Brene is telling the story in this interview about how she met with these sign language interpreters, and she, out of curiosity, said, what I'll be talking about a lot is vulnerability. What's the sign for vulnerability? And they showed her, and you can't see us, but I'll explain it. It's this idea, the way that the sign for vulnerability has historically been is the sign that means weakness. And she explains this in this video clip, and she shows the sign in the video clip for what weakness is, because a vulnerability is kind of a weakness when, in one sense, right? But she, in the video, she explained, she said, no, that is absolutely, is there a different sign that we can use? Like, what else can we use? Because that is absolutely the opposite of what I'm trying to say here. So they did a little bit of brainstorming, and they came up with a different sign, which is now widely used today. And it's kind of a sign where you kind of open yourself up from the chest. Like if you imagine you have a jacket on and you're grabbing it by the lapels and you pull it open at the front to open up. And that's really what vulnerability is. We see it as this idea of vulnerability as bravery and being authentic and true to ourselves. Then we would have a lot more confidence in being vulnerable.
What do you say to the client that says, yeah, but Susie, fine and dandy for you to say, and fine and dandy for Brene Brown to say, and yes, I watched this stupid TED Talk, right? Let's imagine they're past out. And, but, and because we hear that a lot, right? But I've been burned. I was taught, I have learned that this doesn't work for me.
I think that if I had a client in front of me that was unwilling to be vulnerable and so guarded and protected, I think that maybe vulnerability comes later. I would never try and force anybody into feeling uncomfortable in a way that wasn't productive for them. And if that was going to be something that was just too overwhelming in that moment, then we would start somewhere else. I think that if they're willing to be in the therapy room in 2020 on the screen, or 2021, then there's at least we've got a step in that direction. And then we would start with something else. Like as I was mentioning the 2 programs, and I know that a lot of just the general type of work that resonates with you. Also, the idea of understanding your values. People don't really take the time to figure that out. I think that should be something that we, have to renew when we get our driver's license. We have to do a values assessment every 5 years to just kind of reorient with what's important to us. So maybe we start with values, and working through your values is it's also under the umbrella of vulnerability, but maybe doesn't feel as vulnerable because you can kind of make it objective and something about how you're behaving. And then work through things like, trust. How does trust develop? What's the dangers of being vulnerable? Who can you be vulnerable with? Because I think those things are really important to go hand in hand. Is that, as you said, I've been burned before. Okay, well, maybe that person didn't deserve your vulnerability. Maybe you get to empower yourself to choose who you're going to be vulnerable with going forward. And if in therapy, hopefully the experience of most people seeking therapy is that they have a safe place with their clinician who is there to support them, and they can practice a little bit of vulnerability there. And even saying, I don't want to be vulnerable is being vulnerable in a sense, because you're sharing something about how you truly feel. So building little steps towards it, and then being really discerning about who you are willing to share your vulnerability with. I don't know that we should be vulnerable with anybody also, because sometimes you do get burned. And I agree with that. And, there are wrong people to get vulnerable with, and in different situations where you may choose not to be. But I think in the end, it is really important to at least be vulnerable with yourself in some sense, or find safe people that you can just be authentically who you are with, because it's just so rewarding to be able to connect with yourself on that level, rather than just kind of live in a kind of superficial way, which I think a lot of people do.
Yeah, and there's that discernment, I think, is such a critical key message, right? That the idea that if we're kind of embracing our vulnerability doesn't mean we walk around as open books with every, stranger we see every which way.
Right.
And that does give control and empowerment to us when we have that ability to get good, right? And we hone that radar over time. We go through our younger years and make mistakes, every single one of us, right? All the bumps and twists and turns that we go through in life, and we learn, right? And I think there's there's often this heaviness. We think about vulnerability and we think, oh my goodness, it means spilling, dropping, sharing, putting on the gram all the big, heavy stuff in life. And yeah, right. We do think that. And I think sometimes when people have a resistance, it's like they think, does this mean? And that isn't what it means. And one of the things that I so appreciate about your clinical style is we both share a love for humor and irreverence in the therapy room. And I think sometimes actually the best way that we can be vulnerable and move through that stuff that feels gross and icky and hard and overwhelming is get a little bit of perspective, and maybe we kind of laugh at the wildness of life some of the time that happens to us. And so would just love your thoughts on the role of humor and how we can use that in our own lives and in our therapeutic rooms.
Yeah, I think humor is absolutely critical because it's something that, while I would hope that just humankind, we all share, when you go back to like, what are your 5 primary emotions, and happiness or joy is one of them. So the more that we can live there, I would choose joy over sadness, anger, fear, all the others, right? Shame, guilt. I would like to be in joy as much as possible. So if I can lighten up the session and pull somebody over to seeing that they can also do that, I think that's invaluable. If you can go through life kind of, seeing the humor in the situation or just having fun with different things, I think that would go a long way for a lot of people. We're all just here for the ride, right? It's all about an experience and what we make of it and how we choose how we're going to respond to things. And, there's some heavy stuff that happens in people's lives, no doubt. And I'm not, looking to diminish anybody's traumatic experiences. I know you're obviously not doing that either. And some things are, a bit more difficult to work through. And you have to figure out a healthy way to kind of process some really, terrible things that shouldn't have happened to people. They shouldn't have to carry those experiences. But in the end, right, there's got to be some way that we can let it lighten. And I think that finding humor, even if it's like,